Hi, my name is Kendall Horbatich, and I am a staff member with the Arthritis Foundation in Indianapolis. Today, I have Amber Wolf and Emily Slavin to talk about physical therapy and arthritis. Emily, you want to introduce yourself?
Sure. Thank you. My name is Emily Slavin. I'm a physical therapist, and I have been involved with the Arthritis Foundation for about 5 years. I originally got involved with the Jingle Bell Run and have got an opportunity since then to get engaged at many different levels and appreciate the role that the Arthritis Foundation has with the population of patients that we see as physical therapists and physical therapist assistants.
And Emily, how does physical therapy play a role in the management of pain for a person with arthritis?
Well, there's many ways that we as physical therapists and physical therapist assistants can really help patients with arthritis. And obviously arthritis can affect a lot of different patients, whether it be pediatric patients all the way through to the older patient. And we first line of our job is really with working with education, so patients can understand the nature of their condition. And activity modification, are there things that maybe could be done a little bit differently based on their limitations? And through manual therapy, we can help patients improve the range of motion at a joint. We can also help with flexibility and strength and the use of assistive devices. So there's lots of ways that we can really educate our patients. And then working with the Arthritis Foundation, there are a lot of resources that are available to us also, particularly with education.
And Amber, what do you do with the Arthritis Foundation?
I am the Community Engagement Director here at the Arthritis Foundation in the Indianapolis office. We serve the entire state of Indiana, and we also have territory over in Central Illinois as well. My roles really center around our mission-based activities. So I work with patient education. I work with education of our healthcare providers and making sure they understand the resources we have available. We work very strongly in the areas of advocacy and working with our lawmakers as well. And then also working with our juvenile arthritis patient base here in Indiana.
So Amber, Emily mentioned the resources that we have available. Can you talk about some of those and how they would benefit a relationship with a local physical therapy clinic?
Absolutely. Well, our resources really are very informative and helpful for both our patient base as well as the medical professionals that we work with, including physical therapists. So we have several online resources that are doing tremendous work right now, allowing people to track their own pain and their own management, working with things like diet and exercise, as well as understanding their diagnosis and knowing truly what it is that they're dealing with. Our online resources also include different help groups and support networks they can participate in. We also have toll-free helplines that they can call if they have questions regarding insurance, mobility, disability, or even just general care. And then for the actual healthcare providers themselves, we offer several different training opportunities. We can educate those healthcare providers on the Arthritis Foundation, how they can utilize our resources in their practices. And then we also have different ways to engage the two groups together, whether that is at our events like the Jingle Bell Run or the Walk to Cure Arthritis, other patient-related events like our Living Your Yes with RA dinner, lunch and learns for osteoarthritis patients, and then just simply being able to provide even written materials for them, like brochures, magazines, and tear-offs.
Perfect. And how can a local physical therapy clinic become more involved with the Arthritis Foundation events?
Well, I think there's a couple of different ways. As Amber mentioned, certainly getting involved as regards to some of the events that are going on. We have two main events here in the central Indiana region. The first is the Jingle Bell Run that'll be coming up in December. That'll be December 8th this year. And that is downtown at Bankers Life Fieldhouse. And there's a great opportunity to participate. You can put a team together. Over the years, we've had several teams, including one from the university, the UND Snowhounds, who participate. But bringing a group of therapists together, having a cause at your clinic, it's something that you can promote and give you a good opportunity to speak with your patients about and get them involved also. And then we have the Walk to Cure Arthritis, which will be in May in 2019, which will be at the University of Indianapolis. And again, an opportunity to really share with your patients about what you're doing as a group out there in the community supporting the Arthritis Foundation.
Perfect.
And from an Arthritis Foundation standpoint, we try to offer opportunities to bring the entire team together. We want the physical therapists and the patients to also work with their rheumatologists or their local healthcare providers. So bringing them to these events allows them to not only see those different aspects in a different light and not just in the office, but also giving them the chance to connect at a committee level. Maybe we have opportunities for a medical committee, and if physical therapists or physical therapy assistants would like to join that committee where they network with others and learn more about the foundation, they're welcome to join. If they are interested in participating in local fundraisers for our teams, whether it is one of our arthritis warriors that we have or our champions for our events, those medical professionals can also attend those events to learn a little bit more about their patients outside of the general appointment.
And what would each of you like to see come out of a partnership with physical therapists and the Arthritis Foundation?
Certainly for me, it is the opportunity that we have to challenge and change the care that we provide to our patients. Definitely more resources. Patients who are better educated with their conditions allows them to better self-manage. And I think we can support them better with what we do as physical therapists when they have the resources available that the Arthritis Foundation offers to them. So care of the patient, I think, is a huge plus that we can get with our relationship with the foundation.
And I would absolutely echo that. I would love to see every local physical therapy clinic and different physical therapist offices to welcome us into their office with our brochures and our resources that we have available free to all of their patients. I would love for us to be their first line of referral when they have a patient with arthritis, and they would remember to send them to the Arthritis Foundation, whether it's to us locally or on the website. Again, just making sure that those patients are getting the best quality of care we can provide to them.
And if somebody wanted to reach out to the Arthritis Foundation, what is the best contact information?
For the Arthritis Foundation, simply going online to arthritis.org/Indiana to reach us here locally. They could also email or call me directly at 317-762-0440 or at awolf@arthritis.org.
Perfect. Thank you, ladies.
Thank you.